when we talk about dental fear, the first thing that, of course, that pops into my mind is that half of the population avoids the dentist, largely out of fear. With some people, finances may be part of it, but I think fear is an overriding part of it. So with that assumption, I realize that at least half of the new patients or half of my patients have dealt with dental fear at one point or another. So I make that assumption right off the bat with every new patient. There may be dental fear that's kind of behind their coming in. They've momentarily kind of conquered that fear to even get in my office. And then what can I do to reassure them to just make dentistry that much more pleasant? And I know that sounds like a crazy word to use when associated with dentistry and pleasant in the same sentence, but really that's the goal, to make it comfortable and not fearful, almost welcoming if that's possible. And we do that alongside the patient. So in other words, I need to spend time talking about their history. If there's dental anxiety that's come in the past, in previous dental procedures that have maybe been more painful than they thought or whatever, I want to talk about that. If maybe they felt out of control during a procedure, I want to make sure and reassure them that that will not happen with me and not happen in my office. And I want to give them all the control we possibly can. And I want this to be a pleasant experience. I ask them, raise your hand and if anything's bothering you whatsoever, and I will stop and we'll do whatever it takes to make things easier for you. You know, the subject of dental anxiety is obviously a huge, huge subject. And there's one patient that comes to mind that I'm thinking that had such severe dental anxiety that he contemplated the fact that he had dental pain. He put it off for like 3 months. He knew that particular truth that was driving him crazy. He's taking Advil and Tylenol, and it's becoming more and more loose. It's become gradually more and more swollen. It gets to the point that he literally is swollen out on the side of his face by about 3-4 inches. I mean, not to exaggerate, but huge. Finally, he calls in desperation, comes into our office, and this man's 60 years old at this point. He is sobbing with anxiety and pain and, believe it or not, shame. People feel far more shame than I would ever expect or ever think. And they'll tell me, I feel so ashamed that I haven't called earlier. And what I'm thinking as the dentist is, oh my gosh, shame. No, I am so glad you're here. Let's see what we can do together to solve your problem. So I will lay out for him what we can do, small steps to get control of his infection and to reduce his pain. And I'll lay that out coming alongside. In other words, I am not going to tell him what we're going to do. We're going to talk about options. And most of the time, he's probably going to agree with what I'm suggesting. And we're going to do it at a slow, easy pace that he begins to feel confidence in me. And that's when we see a reduction in anxiety. Over time, it literally goes away. Now, I know I'm giving you a rare case. Sometimes it doesn't go away as quickly. But time and time again, I do see a trend. We try to set a pathway forward where people feel less and less anxiety when they do come in. You know, I'm thinking of a guy in terms of talking about how reducing their dental anxiety impacted their entire life, their overall health, their emotional outlook. I think some people that have this tremendous dental fear, it takes up far more space emotionally than you might expect. And that, as I mentioned, the shame that's associated can be a big part of their lives. So when they finally come in and we start making progress, and that shame goes away, that fear goes away, and the bleeding gums go away, and that terrible odor they may have had starts to go away. they feel better about themselves. And I've just noticed they start taking care of themselves a lot better. Even those people that have been smokers for years will start smoking less and maybe even quit. Or those people, and I'm not going to say this is the answer to alcoholism, but those people that have not taken care of themselves, I've seen that they start taking care of themselves better in every dimension. So it's really been satisfying to be a part of that. We're talking about the possibility of sedation, when to use sedation and when not. I really opt for, that's just a last resort. I try everything possible to gain that patient's trust and to perform procedures in a comfortable manner so they will not need sedation. Obviously, if they need sedation, they have to have a driver. There's going to be time of recovery, and it's far more practical. It's less expensive. If we can just do whatever it takes to deliver their care in a comfortable manner, that they are fine with moving on with their life after the treatment's over.